If you have ever been in the healthcare sphere at all or watched TV about any medical anything, I am sure you've seen the jokes about the month of July.
How's Paige?
Aw, first day, Bambi.
And the interns. The whole, don't get sick in July, you'll come in with a cold and they'll kill you quicker than you can sneeze comments, the memes of babies in lab coats walking around the hospital in packs, just like all of the beginning of Grey's Anatomy, just like the, in general, many jokes about intern physicians who all start their jobs as doctors on July 1st, every single year. Have you heard those jokes? Have you said them? Because I have absolutely said more than I can count. And in today's video, I just want to talk about why this attitude, like so many attitudes in healthcare, needs to change. I'll also talk about what caused me to reevaluate how I talk about the whole topic. Because like I said, I used to make the jokes and laugh right along with them just as much as the next person. And we'll talk also about why I think it's important to make this small but overall, hopefully larger impacting change. Hey there, I'm Liz. I am a family nurse practitioner, and prior to that, I was a med-surg and a pediatric nurse for many Julys. And as I said earlier, I shouldn't laugh, I have said more jokes about new residents than I could possibly even recall. But I've also developed a new perspective over the last few years in my role as a nurse practitioner. And that's really changed my attitude surrounding those jokes and this whole residents are dumb and I know more than them attitude that nursing can sometimes have in general. Now, obviously, this is not the attitude that everyone has, thankfully. And I have seen many examples of nurses and other more experienced staff members taking residents under their wing and helping them. And it's also honestly not nurses' jobs. I'm a nurse, so this is kind of focused at nurses, but it can apply to whoever. But it's not anyone else's really job to fix the environment and the structure of how residents are asked to learn, which is, it's an insane environment. But from what I've seen and what people have told me, there is just a huge culture of nurses versus residents, and it's almost expected that there will be a general discomfort and unease between the two. Nurses really thinking residents are dumb and unable to make decisions, and residents thinking that nurses are completely overstepping the boundaries, trying to tell them what to do, and are really rude. And I really think a huge part of that is because we never in our training really get to live in each other's shoes or understand where the other people on the interdisciplinary team are even coming from. And when it came to knowing exactly what the new interns and residents actually did all day or all night in my own experience, I honestly never gave much thought to it because I was so focused on what I needed to do and how the residents' actions potentially impacted or inconvenienced me, or how at least I perceived their responses or lack thereof as blowing off my concerns about my patients. I was very worried about how things looked from my shoes. So I made jokes about the interns with my peers to help us cope with the frustrations in general about our jobs. And I didn't really worry about what life looked like from the interns' shoes. So fast forward a few years and I was in school to be a nurse practitioner. And I was starting to try on some new shoes and see things from a different perspective myself. And I was starting to be asked to do a lot of the tasks that were quite similar to the tasks that these new residents were doing. And the more time I spent in this perspective, the more I began to understand how things were way more complicated than they seemed from where I was at the nursing station or at the bedside. And I wanted to just share that in hopes that the next time you hear these jokes or you think about making one yourself, you maybe think twice, because healthcare is honestly, it's hard enough and we don't need to be tearing each other down at every single opportunity. First, in case you aren't familiar, I thought I would share some background on this whole situation so that it makes more sense. In the United States, physicians go to medical school for 4 years. This is a general education, and there really isn't one focus on a specialty area unless you have some, like electives in your last year that tend to be where you're sort of aiming for residency. But it's a general degree, and after graduating, they then attend a residency, which provides them with several years of training in their specialty of choice. And as I said, it begins on July 1st, rain or shine. And specialties are things like family medicine, pediatrics, radiology, surgery, all of those. Residency is usually like 3 to 12 years long. I'm not even kidding. I'm sure people have been in residency and then like fellowship for 12 years. It's absolutely insane. Thank goodness for them, because I mean, you're really good at your job at that point. So go you people. But what else is insane about this whole thing is many people in residency are living in totally new cities, away from their family, away from their friends, because residency does this really weird thing called the match, where you essentially do a bunch of interviews at a bunch of different programs, and then you rank them for like who is your favorite to least favorite, and then they rank you in terms of who is their favorite to least favorite candidate, and then everyone enters their favorite list into the computer, and then it does a bunch of calculations and spits out where you will be spending the next few years of your life if you match at all. Because some people go through all of this and then you don't even match, and that's just ugh. It really reminds me of the whole system of like rushing a sorority in college. You know, they like come up, they have like dinners where you're meeting all these people. There's probably schmoozing. I don't know. I've never been there. But it's like it's the whole deal. So if you land a residency, many people in those residencies are going to be working 80 plus hours. 80 is technically the cap, but they work more. They make like $50,000 to $60,000 a year in most areas of the country. That's the average. And they are rotated through units and places in the hospital at like healthcare setting in order to expose them to the most number of things possible so that they're super prepared when they go out in the world as attending physicians on their own. And this method is really great for exposing people to a ton of different things. But it also really means that as soon as you get comfortable on a unit and you feel like you have your feet under you, you're moved on to another one. And they're working truly insane hours. They're getting almost no time off, like a few days a month, and they have to be studying in their off time for these different exams that they have to pass. The whole system, it just honestly, it sounds like torture, and it's a huge reason behind why I long ago decided I didn't want to become a physician, because I met a resident and she was not having a good time, and she was like, run, and so I did, and now, here we are. That's a story for a different day. But residency overall is seen as like a brutal experience. And the first year in particular, your intern year, is supposed to be like a special type of torture from what I've been told. Because as you can imagine, you graduate from medical school with a generalized education and about $300,000 worth in debt looming over your head. So you cannot quit. You have to keep going so you can pay your loans. And then you are moved to a new city that's away from everyone you know and love, and you start working 80 hours a week on nights on a service that covers like 4 different units. And you are responsible as the intern to hold the pager and respond to all the concerns that the nurses, the respiratory therapists, everyone taking care of these patients, all their concerns, they go to you. And when the patients aren't doing well, that's your problem. And you are also in charge of admitting patients that are coming in overnight from the ER. You have 20 to 40 patients on your total list, and you can admit 5 or 6 more by the morning. And you have never really worked with some of these populations in med school. And yes, there is, before you're like, what is happening? You do have a senior resident with you who you can ask questions to, but they are trying to kind of keep the ship afloat because you don't know what you're doing yet. So they're going through the pages, they're double checking your work, and maybe they're trying to sleep because the senior resident might be on a 24-hour call and they've been awake for 30 hours at this point. So that's kind of the setup for this really great situation. And now let's play out a little scenario, okay? We have a brand new, super exhausted and homesick intern, because this is their second night ever as a doctor. And a nurse comes to them and asks for Tylenol for a patient that is in pain. And the intern says, hold on one sec, let me check. And the nurse rolls her eyes because it's just Tylenol. I mean, I've been that person, I won't lie. Just give me the stupid Tylenol. But in the back of that intern's mind, they're thinking, how is their liver function? Am I masking a fever? Do I need to do a septic workup? What kind of access does this person have in terms of if they need IV fluids or antibiotics? oh, why are they even here? Is this normal for this course? And they're probably thinking like, oh my gosh, I should really know this. And I don't know this. And that imposter syndrome sets in and it's like, what am I even doing in this position? And while they're sitting there having this little bit of a crisis, they then get paged again. And it's another nurse asking for an order for some IV fluids. You look the situation over and yes, you think, yeah, they do need some IV fluids. So now they have to decide what kind of fluids. Look that up. Okay. How much? Calculate that as well. Great. And how the heck do you even put this order in so that it makes sense? And this poor intern thinks they have it all in correctly. They put it in the computer and then immediately get a page. The order is wrong. Okay. So they'll fix that order. But while they're trying to do that, another page from the first nurse. Can I please get Tylenol? All caps, the angry page, and crap. They forgot to look up that person's liver function. And then they're thinking like, wait, do I even really need to do that? Like maybe it is just Tylenol. I don't know, but they don't want to miss anything because they are brand new and taking care of people's lives. So they're starting to look it up. And then they get a page from the emergency room about a patient with a GI bleed and they're going to be coming in and they need to go down and do the admission. So they page the senior resident because they're like, oh my gosh, I'm kind of starting to drown here for backup. But she is busy dealing with another decompensating patient. So the intern, the brand new doctor, is going to be going down there alone to be doing this interview and trying to admit this patient. And as they're heading down the stairs to go to the emergency department to talk to the new admit, their pager starts making insane noises, alerting them that one of their patients is having a rapid response, which is when like you call everybody and you try to keep the patient, they're not doing well in that case, for acute, let's say, respiratory changes. And they still haven't put the order in for the Tylenol for the first patient. The order for the fluids is still wrong. While they're down there dealing with all those situations, the nurses start spreading the joke about it being just Tylenol. And everyone on the unit is kind of talking about like how they hate July and all the interns. And then a few hours later, the mentally exhausted resident shows up and you can hear people talking about you. You can hear people talking and like laughing and like looking at you. And so off the resident goes to cry in the bathroom. I have found many a resident crying in the bathroom, guys. And while they're in the bathroom, their pager goes on again for something new. And this goes on for 80 hours a week. So I think at this point, we've established that in the first few years, residents have a ton to learn. And I think this is a really good place to say that this is not just a nursing issue. Some nurses are, yes, incredibly rude and awful. And some residents are incredibly rude and awful. And it's not like everyone comes in and is like, oh, I want to learn. Some interns definitely come in and are incredibly arrogant and like, do they think they're God's gift to the unit and they're really hard to deal with? Oh yes, and are some nurses on the flip side super mean and cannot wait to pick apart new residents and show them who's really boss here? Absolutely. But I would honestly say, are most residents in my experience just super tired and overwhelmed and lonely? Yeah, they are. And are most nurses in it to be mean? No, I would say they're probably tired and overworked and need things to go smoothly because their assignments are already a train wreck. And so new interns are coming in and the process is just slowing them down. The way we train healthcare workers in this country is crazy. And the conditions that many people are asked to work in many times are less than ideal, like in terms of staffing for like nurses. And it is beyond frustrating. And yes, interns do slow down the whole process, just like new nurses do, and new respiratory therapists and new techs. Everyone that is new slows things down. But making interns the butt of the joke isn't really helping. It's just worsening a divide that is already quite difficult to communicate across. And it makes it harder to work together to fix the ridiculous healthcare situation we have going on in this country if we don't all work together, because it's going to take everybody working together to fix this, what I really can only call like a catastrophe. Also, just something else to think about would be, if this is an intern's real first experience working with like a nursing staff, wouldn't you want to get that entire career off to a good start? Like, right? Because we all know there's like some strife there. So your encounter could be a good one versus starting it off on the wrong foot. So just some food for thought. Okay, that was quite a tangent. Thank you for hanging in there with me. And I have never even been a resident. Can you imagine this rant if I had been a resident? Oh boy, okay. But in case you can't tell, I am like weirdly passionate about this. And this is where it kind of hit home for me, and this is why. So I was in clinical for NP school, and I was at an urgent care. A patient had come in with a leg injury and they had a temperature of like 100.2 Fahrenheit. So not technically a fever, but their temperature was higher than where they would normally hang out. And the MA, she came up and she asked me if she could go and give the patient some Tylenol while they were waiting for our imaging that we had done to come back. She already had the Tylenol in a little cup in her hand. She was obviously expecting me to say yes. And my immediate thought was, oh my gosh, I don't know. What if they have liver issues? What if they are going septic? And this is like masking some of the symptoms and we're reducing their fever and they can't fight it. I need to check on what is even going on here. And then I was like, oh my gosh, like it was kind of that moment. I was like, this is what residents feel like, but they don't even have like a supportive staff necessarily around them all the time. I was really lucky that day in that my preceptor patiently, like a saint, walked me through the entire process on why giving the Tylenol was totally fine in this scenario. She didn't give me shame for questioning it. She didn't act like it was a silly question. She just kindly helped me along and gave me a rationale that I could tuck away into my brain as information for next time. And 2 nights later, literally, I think at work, when an intern was agonizing over my request for Tylenol, and immediately I started to get annoyed and think like, oh my gosh, it's just Tylenol. I thought back and I was like, oh my gosh, I feel so crappy because that feels really crappy to not know what to do and to know people are like waiting on you. Like that is just the absolute worst. And I am really lucky that I was not laughed at for making that decision and like agonizing over it. And how on earth would I feel if I was? And I totally in that moment, like, and I'm not tooting my own horn, I'm just saying like, I changed how I talked to that intern just in that I gave them a lot more patience instead of being like, come on, I was just like, okay, you go look it up. I mustered like as much kindness as I could in my stressed moment. And I was like, all right, dude, like you go figure it out. And when you go figure it out, like come back and we can kind of proceed from there. And it went pretty well. I hope I made that dude's night a little bit easier. It took a while, but we got there. And when you are new, I just want you to remember that everything is hard. Nothing is on autopilot and you're constantly having to make all these decisions and you are going to choose things that seem really silly from the eyes of someone who has done this job for years. And you are going to really not be good at your job at first, okay? And how cool would it be if when we met new interns, we just introduced ourselves and we're like, hey, I'm Liz. I saw that you were working the blue team tonight. I have a few patients that are on your list. Let me know if you have any, like questions about them. I'm pretty familiar with this population and these patients. I've been with them a few nights. I will be sitting right over there. Or you can always page me. Oh, and the coffee is like over there. Always give them the coffee, guys. Just share the coffee. And it's done. It takes like 30 seconds. Or you can just ask them how they are. I cannot tell you how many residents I have accidentally made cry just by being like, if they look like how it, depending on how the situation is, like, ooh, are you okay? Like, rough night? Like, because if they're pretty much already looking like, a disaster, they're probably having a rough night. And it's sad that like that made them cry because no one else had obviously extended that simple question to them. I just can't imagine how lonely that would be. So do you kind of get like why I feel bad now? And I felt the need to like come out here and say this. And if so, I thought I would give you some ideas of just like tangible things to help make new residents, or really anyone that's new, honestly, their lives better. First, introduce yourself. If you are a more senior person and feel comfortable, make yourself a point of contact for that person. And if you aren't comfortable yet, introduce them to the people who are that more senior person, like a charge nurse. Let them know that they are available for consult if needed. Obviously, they have their senior residents too, so they might not need this, but many residents already do understand that nurses know the patients and that they are super new on the unit, and many residents and interns will listen. They are often just terrified of us for the reasons that I've already made pretty clear, and they think we're gonna eat them if they talk to us. So we got to work together here. And within all of this, I'm not trying to send the message that you can't question or discuss things with residents. Because sometimes when I was precepting people, they would get mixed messages and they're like, okay, so I should never like really like show any like, oh, what is this? Like when you're not agreeing. And that is not the message here. Please do ask all the questions, advocate, seek clarity, all of that. Just do it nicely. Maybe instead of going in with the attitude of, oh my gosh, you are so dumb, go in with like, oh, hey, new person, perhaps I can help. A buddy mindset versus a competition mindset. If, for example, they put in an order and you're like, interesting choice, I don't know if that's right. You can question it politely. Hey, I saw you ordered this. I've seen LR ordered commonly for these patients, and I just wanted to make sure that you wanted the normal saline for them. Okay, perfect, you do? Thanks, just wanted to check. And they may ask you for your input, like, is that normal? You can ask them like, hey, like, I'm just curious of your reasoning. They may ask you, like I said, they may not want your input at all. But you've done your job, you've advocated. And if the order is dangerous, then by all means, press more and be like, no, friend, no. But you can do all of that politely with what your concerns are. In like all reality, very new interns probably have no idea that this is the standard or what your standards are for your patient population, because they have worked there for 2 days and you have been there for 5 years. So expecting them to be on that level is insanity. Okay? Yeah, yes, you probably do know more about your patient population, I would hope, after 5 years than them after 2 days, but let's just catch them up to speed instead of like belittling them. And another thing, if they are all hanging out and like everyone has a moment, it's okay to just be curious about them as a human. Are they new in town? Let them know the best food to deliver to the hospital and how late they'll deliver it, or the best place to grab a beer on their day off. Be like just a normal human coworker. I feel like we don't treat residents like they're just normal humans that we can like work chat with. And honestly, like that's weird. I knew and chatted with all the respiratory therapists, the CNAs, the techs, the phlebotomists, the housekeepers, like all the people, because if you were in the room together, you just like chatted. But at least in the hospital culture that I was with, no one just like chatted with the residents. And that was just odd to me. And I feel like that would just increase communication and make things overall better. So they won't eat you, most likely, and just go ask them how they are and what's going on. And that concludes my spiel on that. Overall, just be kind. I am not trying to come on here and be like, squash all the jokes. I know a ton of people are gonna be like, oh my gosh, Liz, like calm down. But this one has just rubbed on me more and more the wrong way over the years. And as I see a bunch of memes coming up, because it's about to be July, I needed to talk about it. Hopefully it gives you a little bit of a different perspective and we can start to slowly change the healthcare culture to be accepting of new people, helpful and collaborative. Maybe they'll, more physicians will be nice to nurse practitioners because of it, or nurses in general. This is actually self-serving. You didn't even know that. It's really just being kind, and having that first interaction be kind can only benefit all of us. In a perfect world, I really do think all med students should have to shadow a nurse and vice versa. And even like everybody, like why don't we shadow pharmacists and all the things? And when I rule the world, we will all shadow each other and get a look from everybody's shoes. And until then, we can just learn from each other and proceed with kindness so that our patients are getting the best care with collaborative communication. We can get a little bit more enjoyment out of our jobs, and we can one day unite our powers to completely overhaul this garbage healthcare system we currently have. All right, if you have any thoughts on this or any stories to share related to your experience as either a new resident or a new provider, I would love to hear them. Or if you're a new nurse, everyone's been new. So what helped you when you were new? I'm probably pretty sure making fun of you didn't help you. Or if you're a nurse or a CNA or another member of the healthcare team, what have you been able to do with to help new people? And hopefully we can all read all these things and get an idea of oh, this will be a cool way to interact with new people from now on, because we have all been new once, and just because people might have been mean to us when we were new doesn't mean we have to be mean to them. Thank you, friends, for listening to my rambles. If you have anything else you would like my unsolicited opinion on, let me know in the comments, and go forth and be kind. Happy July, friends. See you later.